Dr. Sessa, what happens if I stop my weight loss injections?
So there's a couple of things that are going to happen when you stop your weight loss injections. So number one, your appetite is not going to come back immediately. So it actually takes quite a while, 4 to 6 or 8 weeks for your appetite to start coming back from a GLP-1 injections. But one thing that will definitely happen is you will notice that your skin is a lot looser. So when you're on GLP-1s, you typically lose up to 40 to 60% lean muscle mass. That's what you've lost. So when you've lost weight on your GLP-1, it's mostly muscle mass. Now you can counteract that by doing weightlifting, but when you're not eating, you don't really have a lot of energy and your energy levels kind of decrease. You're not really motivated to actually go and do some weight training. So what is the answer here? The answer is you have to force yourself to do more weight training. So what are the effects? So the effects when you stop taking your GLP-1s is number one, loose skin. You're gonna have loose skin here. You're gonna have it on your face, on your tummy, on your neck, on your butt. And then the other thing, eventually your appetite will come back, but it'll take a little while.
Interesting take. Now, I'm an obesity physician. I've seen thousands of these patients and overseen tens of thousands if you include the doctors I've overseen over the years who have also seen these patients. No, it usually doesn't take 8 weeks for your appetite to come back. People notice it pretty quickly. The drugs have anywhere between a 5 to 7 day half-life. And after that, that's when people notice, even when they extend their doses past a week, and even at the end of the week, they start noticing their appetite increasing. I mentioned looser skin. Yes, this is what happens when you lose weight in general. Even if you lift weights and hold on to all your muscle mass, you can still have a lot of loose skin. So it's not something that is just from these GLP-1 medicines. He said people lose 40 to 60% of their lean mass. Now I'm doing studies in this research area, and what we've seen from subgroup analyses of the randomized controlled trials with semaglutide and tirzepatide is somewhere around a 39% fat-free mass loss from semaglutide and somewhere around 25% fat-free mass loss from tirzepatide. It's very important to note that it's fat-free mass, not muscle tissue. So some of that could be fluid tissue. Not all of it is muscle. He is correct that we should be promoting resistance training, but not everybody's going to do it. The resistance training and sufficient optimal amounts of protein can minimize this muscle mass loss. So in the end, what's going to happen when you stop your GLP-1 medicine? You may notice increases in appetite within a week or two of coming off. Some people can manage a little bit longer, but in general, it happens a lot quicker than that. I wouldn't be worried about the loose skin. Yes, we want to lose weight maybe a little bit slower than what people would like to make sure that we're not losing too much muscle. Yes, we want to make sure our protein's sufficient as well. Yes, we want to make sure people are lifting weights. But no, we don't want fear-mongering around these medicines.